On this episode of The Doctors, we will discuss Alzheimer's disease, which is caused by a combination of environmental, lifestyle, and genetic factors with guest neurologist Dr. Jay Kam from Johns Hopkins University.
Hey, Dr. Breezy here, and today we'll be talking about Alzheimer's disease. Please welcome all the way from Johns Hopkins Medical Center, neurologist Dr. Jay Kam.
Glad to be here, Dr. Breezy.
I'm glad. So, Dr. J, in our recent survey of audience members, many people were very curious about Alzheimer's disease. Could you tell us a little bit about the disease?
Of course. Alzheimer's disease is the most common form of dementia and the sixth leading cause of death in the U.S. Dementia is the most general term for memory loss and other intellectual abilities that may become serious enough to interfere with everyday life.
Wow, so how does Alzheimer's affect the brain?
Well, with it being such a huge problem in the United States, Alzheimer's is still under a lot of research. We have here a model of the human brain. Your long-term memories, like what presents you got on your 8th birthday or what you ate a few days ago, are stored in your temporal lobe here. When your brain first receives stimuli or information, the prefrontal cortex in your frontal lobe here stores it as short-term memory. Throughout the day, short-term memories will be transmitted to the hippocampus in the limbic system of the unconscious brain, where they will be either kept and given to the temporal lobe or discarded permanently. When a person has Alzheimer's disease, the neurons that transmit these signals cannot be transmitted across the synapses, so information cannot travel from place to place. Memories are lost on the way to the temporal lobe.
I see. So how does Alzheimer's then progress?
Well, your brain is a lot like a factory, so if one part stops working, then other parts slowly stop functioning as well. Alzheimer's will first affect your short-term memory, and then it goes into your long-term memory, which will begin to be lost as well. Pretty soon, Alzheimer's will affect other action potential transmissions in your brain until you can barely carry out normal everyday tasks, such as brushing your teeth or going potty.
Well, according to our survey of the audience, most people knew that Alzheimer's affects your memory, but most didn't know the cause. So, could you tell us what causes these neurons to stop transmitting signals?
Of course. So neurons, well, they work like chains in the way that they pass action potentials along the line until they get to their destination are not connected. The spaces in between the axon and the terminal of one neuron and the dendrite of the next neuron is called a synapse. When a person has Alzheimer's, deposits of protein fragments called plaque build up in the synapse and prevent action potentials from diffusing across the synapse.
So, is this plaque only found in Alzheimer's patients?
Actually, it's not. Plaque and tangles, which are twisted fibers within a cell, are found in some adults as they age. However, more of this plaque and twisted fibers are found in Alzheimer's patients. This plaque begins in memory areas, but may spread to other areas of the brain. Scientists are still not positive, but most believe that tangles and plaque block communications between neurons and disrupt processes that cells need to survive.
So basically, a stimulus or action potential will be bouncing along from neuron to neuron, like this ball, when, all of a sudden, a wall of plaque stops the ball from continuing onward.
Exactly!
So, Dr. J, what are some of the warning signs that a person may have Alzheimer's disease?
Some beginning signs may be normal memory loss of simple things like forgetting to go to an appointment or where your car is parked. These things will be forgotten for a moment until the patient remembers again. This memory loss will become progressively worse until the person cannot remember their car or that they put soup on the stove. Sadly, Alzheimer's is usually not detected until its more serious stages, because we accept memory loss to be a normal part of aging. At its most developed stages, Alzheimer's disease will destroy a person's long-term and short-term memory, so they cannot remember their name or what they even ate 2 minutes ago.
That's so sad. Now, it's my understanding that Alzheimer's is currently not treatable. Is that true?
Well, 90% of what we know about Alzheimer's has been discovered in the last 15 years. Hopefully, with more research and development, we will be able to treat this horrible disease. Currently, there is medication available that will halt the spread of plaque buildup for a certain amount of time, depending on the person, really. However, no treatment has been developed that will stop the buildup of plaque, nor destroy the tangles. Unfortunately, death is the most likely outcome for Alzheimer's, which is why it is the sixth most common cause of death in the U.S. The plaque will cause neurons to stop functioning and deteriorate until your most basic life functions that are contained in your unconscious brain, such as breathing and heartbeat, will cease to occur. Signals cannot be transmitted to the appropriate parts of your body, causing vital bodily functions to stop.
Well, thank you, Dr. J, for educating all of us. We will now take questions from the audience about Alzheimer's disease.
My father was just recently diagnosed with Alzheimer's disease, and I was wondering how long it takes the disease to reach its final stages.
Excellent question. The average person reaches the final stages of Alzheimer's after about 8 years, but disease can take anywhere between 4 and 20 years to progress completely.
What are some medications that he could take to halt plaque buildup or help with his memory?
Well, there is donepezil, which is used to treat symptoms of moderate to severe Alzheimer's, along with memantine, which may treat symptoms but has limited effects. Other drugs include rivastigmine or glamamine.
Dr. J. Com, thank you so much for being here today and enlightening us on this awful disease.
You're welcome.
To decrease your chances of developing Alzheimer's disease, here are some tips. Exercise regularly each week. Have regular checkups to see that your blood pressure is at a normal level. Practice good dieting habits with lots of fruits and vegetables. Mentally challenge yourself with activities such as reading, playing music, or playing a game that stimulates brain activity. Engage in social interaction often. Coming up on the doctors, how personality disorders affect the brain.